I'm Dr. Bennings, president of Kellogg Community College, and I have the honor and the privilege to have a conversation with Jeannie Goodrich, Chief Executive Officer of Summit Pointe. And so one of our topics that we'll talk about today is something that is very near and dear and critical in our communities, and that's mental health. And May, as you know, is Mental Health Awareness Month, and it really, for me and many of us, is just a time to raise the awareness of mental illnesses which impact our communities, our families, our children, and even our own dealings with mental health. So the goal here is really just to hopefully have a conversation and stimulate that dialogue in our community, but also understand that there are resources out there to help where it's needed. So I want to start off with some facts and figures. And so I just have 3 to share, and they're from the 2021 State of Mental Health in America. And so in that report, it says 24% of adults with a mental health illness report an unmet need for treatment. And it indicates too that this number has not declined since 2011. Another fact says 60% of youth with depression do not receive any mental health treatment. And then 10.8% of Americans with mental health illness are uninsured. And, Jeannie, I think your role, I haven't had many interactions, but our interactions will continue after this. But there's such a vital need for this in our communities. And so this is full circle moment for you because you are a KCC alum, and I'm glad to have this honor to sit with you. So, Jeannie, tell us about you, your role, and Summit Pointe.
Sure. So I've been the CEO since 2015. I've been with the organization about 27 years. So grew up essentially in the organization, starting as a coordinator and working my way up through the organization. So that's a little bit about me. And before I go on, I just wanted to say thank you for the opportunity today. Mental Health Awareness Month is something near and dear to my heart, and it's just really nice to be able to get information out about behavioral health services in Calhoun County. So let me start a little bit with Summit Pointe. So Summit Pointe is the community mental health of Calhoun County. So what does that mean? That means that we provide community-based services for people with a serious mental illness, an intellectual developmental disability, and we also have outpatient therapy. We do substance use disorder therapy, and we have medication management. So we have a full continuum of services available for someone that has a behavioral health or substance use disorder. In addition, over the last few years, I've been expanding services through the use of grant funds. And so in some of that work, we've been collaborating with law enforcement and doing crisis intervention training. So that's been a very nice piece in our county. We've also done some harm reduction grant work with Life Care Ambulance and with some substance abuse prevention services across Calhoun County. And we've been working with our local courts with an assisted outpatient treatment grant. So really trying to expand the work that we do through some grant funded activities.
Wow, that's amazing. It sounds like you have to be responsible for quite a bit, but it's very, very valuable. And there's so much that you mentioned that I definitely want to learn more about. So just a few minutes ago, I shared some facts and figures from the State of Mental Health in America report. So can you tell us what is the prevalence of mental health issues in our own community?
Sure. So let's just take this right down to our local community level.
Okay.
So My Calhoun is a website that's available, and some of the statistics I'm going to talk about are available on My Calhoun. And so a couple indicators that we watch. These are figures very specific to Calhoun County. So suicide rate is 42% higher in Calhoun County than any other state or on the national average. Drug-related deaths increased by 56% from 2019 to 2020. During the same time period, 25 opioid-related deaths have occurred between January and June of 2020. And so that has representing 9% of the deaths in Calhoun County. So I'm looking at my notes to make sure I get these right. And then just to follow up. So this is the work, this is the data that makes our work relevant, right? So we always want to impact this work. So I talked about services, I talked about grant pieces. One of the things that we've recently opened is the First Step program, which is the urgent care center. In our first 30 days, we have seen 300 individuals, or 300 visits, 281 individuals. So a few community residents have come more than once. That's because of the chronic needs that they have. And so getting them set up with aftercare services after their urgent care center visit is critical, but it's because they have so many needs that they keep coming back until we can get them to that next place where they can receive services. The last couple pieces, I talked previously about our CIT program. We are starting our 4th training. And so we have about 70-ish officers in Calhoun County that are trained. We have about 1,000 contacts in our community by CIT officers, in which an officer responded and had a CIT response. So we're just giving them some tools, mental health tools in their toolbox, and they've had a response and they've had successful. It's reduced the number of people going to jail. We've also done a study on our jail population. And in our jail population, 1/3 of the individuals being booked currently into our Calhoun County jail endorse or have hit a positive result on the screen that we do, and they have serious mental health symptoms. So those are startling statistics, right?
Yes.
So that's why the work that we do, that's why I'm always trying to look for how to expand the work that we do, is just to provide services for our population.
I just had to take a deep breath because those statistics are startling and scary at the same time. And it took me back to a moment in time when I had, in my own family experience, suicide and depression and anxiety and, other emotional mental disorders. And just to know that there are community resources out there such as Summit Pointe gives me a reassuring comfort to know that, they're not alone.
Right.
And so, but I just had to take a deep breath because that was my first time hearing those statistics specific to Calhoun County. And it's real. And even those that we talk to day in and day out could be going through their own mental health issues.
Correct.
Wow. So, there's stigmas, around mental health, and whether that's cultural or by values and beliefs or identities and backgrounds and experiences. So what can you, share in terms of most common stigmas and tips on what can we do to overcome that?
So stigma is real. I mean, a lot of the statistics that you started with at the beginning have a lot to do with stigma. People don't like to access mental health treatment, right? So for a lot of people, it is a sign of weakness. It's a sign of a moral failure. Somebody feels like they're doing something wrong if they have to seek treatment. And so really for us in this world, in treatment, we just try to talk about it and try to normalize it. And getting treatment is what you need to do. It is how you will, eventually get to the point where you can say that's in the rearview mirror and this is, my life moving forward. And mental health first aid. Mental health first aid is an 8-hour class that helps people understand the signs and symptoms. And so if you have a family member or you have a neighbor and you recognize signs and symptoms, people don't feel comfortable asking, right? They don't feel comfortable saying, "Are you okay? And let me help you." And so some of the pieces inside of mental health first aid allow people to recognize signs and symptoms and then let people feel comfortable with having the conversation. And then the last thing, I will say that it's just too often people just don't reach out for help, right? And there are so many avenues, there's so many ways, there's a hotline, I'll talk later about Credible Mind. There's so many different ways to receive treatment. Yeah. It's not, I have to be seen going into a center and somebody that I live by might see me. And so there's a various number of ways.
Wow. You mentioned something so important in terms of the reach out component. And I, even in my own life, had some difficult periods of time, and I had just a wonderful family support. I think of my mom who was there for me, and she, there was one day she walked in and I was asleep and I felt her rubbing my arm and she said, Adrien, are you okay? And those small words to come from someone so close to me was it made a difference in just how I woke up that day and faced my day, knowing I had someone there to face it with me.
Sure.
So that takes us into my next question. Can you share some tips on how I can take care of myself during this time and how we can live mentally healthy, especially during COVID? It's crazy, right?
Right. So mental health first aid has a wonderful phrase, and it's the ability to live, laugh, learn, and love.
Oh,
right.
Beautiful.
So when we have a mental health concern, that impairs our functioning. So we don't have those abilities. And so anytime you have those abilities, that's when you need to reach out. So, and as I said earlier, reaching out with either calling someone on a hotline, going into the First Step program on College Street, calling someone, going to your primary care physician, just finding someone that you trust that will be able to help you seek services, seek resources. Those are the big things that we have to remember.
Wow, that's amazing. Wow. So because, mental health challenges aren't always visible on the outside. You can't say, I know what mental health looks like, or that is the sign of mental health. What signs should we look for in ourselves or in others that may indicate the presence of a possible mental health challenge?
So, the pandemic has put a lot of pressure on all of us, right? So the stress of just everyday living was already, impacting families. And then you put the pandemic on top of it, and people are at home and they're working from home, and there's classrooms are at home. There's a lot of stress now, and so the signs and symptoms are probably a little bit more prevalent now, a little bit, you have more exposure. The things that you really have to watch for is, are you sleeping too much? Are you not doing your daily activities? Do you not find joy in what you have done previously? Yeah. If any of those are a possibility, we have a wonderful resource called Credible Mind on our website. They have self-assessment tools, they have blogs, they have videos. That is to me a place where, wow, I wonder if I have a problem. I wonder if I have a concern that I need to talk to somebody about, whether it's a primary care physician or a mental health professional. Go there, take those self-assessment tools. That information is totally anonymous. We don't track any of the information. We don't know who's taking any of the assessment tools. It is truly a self-help for people in Calhoun County.
That's amazing that resource is out there, because not everybody might be comfortable with reaching out to a physical person.
Right.
And then there's a resource that they can access behind their closed doors in their own home and help themselves. And so that's amazing.
Yeah.
You kind of hinted at, the website as a, available resource for information. Is there anything else that you would like to share in terms of other resources and or, locations, hours of operations, anything that we can close out this segment on?
Sure. So we have a social media presence. So follow us on Facebook.
Okay.
We are on Instagram, we have LinkedIn, and we have a YouTube channel. So all of those are readily available for people on the internet. We also have a website. On the website, we do have information about our programs. We have information about Credible Mind. And Credible Mind, as I said, is a wonderful resource. I'm so glad we found it and attached it to our website. We have locations all across Calhoun County. Depending on the level of care that you receive will depend on what location you go to. But we're open in our outpatient clinics 4 nights a week in some locations, so we have convenient hours. And then lastly, I'm going to make a plug for First Step.
Yes.
So First Step is our urgent care center. It's open 24/7. It's located at 175 College Street. If you have a question, if you have a concern, there's no referrals, no barriers, walk in. Regardless of insurance, we will answer your questions. We will figure out if you need additional resources, how to get you those resources. And I'm just gonna make a plug for the 1-800 number. So it's 1-800-632-5449. That gets you to our offices during the day, and at night we'll get you to the First Step program.
Wow. That's amazing. So first step is just the name in and of itself of the program is very pertinent because it's one step at a time towards mental health. And it's been a pleasure to sit with Jeannie Goodrich. Kellogg Community College is a partner as well as a referral resource for our students and employees to Summit Pointe. So this is a great way to come together and have a community conversation about something so critical with damaging effects in our very own community. And so I will end with this. Thank you, Jeannie Goodrich and Summit Pointe, for your time and just taking out of your busy schedule to join us, as well as just being a part of just spreading the awareness during Mental Health Awareness Month. So I will say, live well, thrive, and be well. Thank you.